Hi, my name is Anne-Marie Wills. I am the director of the CurePSP Center of Care at Massachusetts General Hospital. Today I'm going to talk to you in general about nutrition in PSP with the help of two of my colleagues, Mansi Sharma and Lynn Garry. First, I'm just going to talk in general about nutrition in PSP. Mansi Sharma is going to show 3 easy-to-swallow recipes for the holidays. So a pumpkin pie smoothie, sweet potato pudding, and a classic French creamy spinach puree. Lynn Garry, who is a registered dietitian here at the hospital who's worked with me on several research projects, is also going to talk about healthy eating, foods for brain health, dysphagia tips, and she's going to answer your questions live about PSP nutrition. First, I'm going to talk about nutrition in PSP. To date, there's very little information about this topic. Unfortunately, we don't have a lot of research that we can discuss. People have looked at weight loss in PSP and found that it happens very early in the course of the disease and it is progressive. It may be related to dysphagia or difficulty swallowing, but that may not be the only cause. From my research in other diseases, I know that there's often loss of appetite and depression that can also lead to weight loss. Dysphagia is a major issue in PSP. Swallowing impairment has been found in up to 80% of people with PSP. And having problems swallowing is associated with a worse prognosis. Dysphagia can be an early sign in 16% of PSP patients. Both the oral and pharyngeal phase can be affected, and dysphagia is often associated with malnutrition, dehydration, aspiration pneumonias, that's when food goes down the wrong way, and worse outcomes. Unfortunately, we don't have a lot of information on the frequency of malnutrition in PSP, nor data on whether treatment for dysphagia will prolong survival. Signs of dysphagia that you can watch out for include too much saliva and drooling, length of time that it takes to chew, getting tired while chewing, having food or drink left in the mouth after swallowing, even after a double swallow, a wet sounding voice, sounding like there's something that's gurgling at the back of the throat, coughing, clearing your throat, or choking after swallowing, especially on liquids. And it's important to remember that dysphagia in PSP can be silent, so people can be choking or taking food down the wrong way without realizing it. There are a couple strategies which your speech-language pathologist will go over, including tucking your chin down while swallowing, taking an extra swallow, using a straw, often modifying foods to make it easier to swallow, such as pureeing foods or overcooking meats to make them softer, avoiding mixed textures, so avoiding like cereal and milk, for example, where there's both a liquid and a solid, and then thickening liquids, and this can be smoothies or some people will add thicket to liquids to make it a little thicker. Some people will notice that their swallowing is better after they have levodopa, Sinemet, and if that's the case, we recommend that you take the medication half an hour before eating or drinking. This is mostly in patients who are responsive to levodopa. Also, if the dysphagia progresses, it may be necessary to have a feeding tube, such as a PEG tube or a PEG-J tube placed, and that is something that you should talk about with your family and with your providers. We looked at some of the related disorders to get some more information for you. FTD is another tauopathy. It's related to PSP pathologically, and some people with PSP will have some FTD symptoms. People with FTD are reported to eat impulsively or obsessively. They might eat when they don't need to, and they might gain a lot of weight. So this is described as mouth stuffing or drinking too fast, and this can be seen in PSP as well. It's not clear if that results in weight gain in people with PSP. If this is an issue for you or your loved one, we recommend that you be very careful with giving access to snacks, sweets, things that people will eat compulsively. This might require you to just monitor what people are eating more carefully. And also it's very important to make sure that people take their time, sit upright, don't multitask while eating, and make sure that they're really focused on swallowing safely while eating meals. Parkinson's disease is another related disorder where there's more information about diet and foods. The Mediterranean diet, which means a diet that's high in olive oil, legumes, vegetables, and fruit, but low in meat, poultry, and animal fats, is associated with a reduced risk of getting Parkinson's disease. Nobody has studied, however, whether eating a Mediterranean diet after you get the disease will slow down the progression. I did look at a very large data set in Parkinson's disease and found that people who lose weight, who have a decline in their body mass index, also have a worse disease progression. This is an association, so it's not clear if this is causative, but it is significant. So in summary, we would encourage you to work with your healthcare providers to try to avoid weight loss, eat a diet that's high in legumes, vegetables, fruits, watch for any signs of dysphagia, and if you do have signs of dysphagia, work with a speech-language pathologist to prevent aspiration. We also talked about texture modification and mealtime strategies to make swallowing safer. Thank you very much for your time. I'm now going to hand it over to Mansi Sharma, who has videos on some easy-to-eat holiday recipes. Thank you.
Hi everyone. So today we'll be going over a few Thanksgiving recipes from the ALS Nutrition app that are dysphagia friendly. And the first one we'll be making today is the pumpkin pie smoothie. So the ingredients that we'll need are maple syrup, pumpkin pie spice, ginger, whole milk, pumpkin puree, vanilla Greek yogurt, and 1 whole banana. So let's get started. So the first thing that we'll do is we'll add 1 whole banana sliced into our blender. And then we'll add 1/2 cup of whole milk. Show everybody. Okay, and then we'll add 1/2 cup of pumpkin puree. Just like this. And then we'll add 1/2 cup of vanilla Greek yogurt to the blender as well. All right. And then we'll add 1 tablespoon of maple syrup. And then we'll add 1 teaspoon of pumpkin pie spice. Like that. And then we'll add a dash of ginger. So here's the ginger. I'll add a dash of it. Just me. And then you'll blend it. It's good to blend on high speed. That usually gives you good consistency. And I'll show you the final product. So the final product of the pumpkin pie spice smoothie looks like this, and it's very thick and creamy and smooth, and I'll just show you the consistency. It's very thick and smooth and creamy, and that's your pumpkin pie smoothie. So move on to the next recipe. So our second dysphagia-friendly Thanksgiving recipe for today will be sweet potato pudding. And the ingredients that you'll need are rolled oats. You'll need soy milk. You'll need cinnamon. And you'll need cooked yams. So the first thing that we'll take 1 cup of cooked yams and add it to our blender. And then we'll take a 1/4 teaspoon of cinnamon. And then we'll take 1/2 cup of our soy milk. And add it to the blender. And lastly, we'll take 1/3 cup of our rolled oats. And now we can see that. Okay, and we'll add that to the blender. And so blend it together on high speed, and I'll show you what the final product looks like. So this is the final product for the sweet potato pudding. And the texture is very smooth. As you can see, it's very smooth and mushy and thick and soft. So it's great for people who have dysphagia. And actually this recipe can cater to anyone, not just those who have dysphagia. So as an option, you can actually serve it with whipped cream. And I'll do that for you right now. And this is our final sweet potato pudding. So our third and final dysphagia-friendly Thanksgiving recipe is going to be the classic French creamy spinach puree. And the ingredients that we'll need are black pepper, nutmeg, salt, spinach leaves, and soft brie cheese. So the first thing that you'll do is actually take 3 cups of spinach leaves and rinse them and cook them over medium-high heat uncovered for about 3 to 4 minutes until the spinach is wilted. So it looks like this. And once you've done that, you can add that to the blender. Okay. And then take about 1/2 cup of soft brie cheese and add that to the blender as well. And just in case you want to know how much that is, it's about this much. Sorry about that. It's about this much brie cheese. Okay. So I'll add this cheese to the blender. And once we've done that, we're going to add black pepper, nutmeg, and salt to taste. So however you like it. So I'll add some black pepper. I'll add a little bit of nutmeg. And I'll add a little bit of salt. Okay. And then I'll blend that together. So this recipe can either be served hot or cold. If you serve it cold, it can be served immediately. If you serve it hot, make sure to cook it in a deep frying pan and reheat on low heat for about 5 minutes. And I'll show you the final product. So the final product looks like this. I'll speed it up for you. It's very creamy and buttery and soft. And so it looks like this. So very soft and creamy. And it slides very easily as well. So thank you so much for watching all of our dysphagia-friendly Thanksgiving recipes. And hope you enjoy your Thanksgiving. Maybe implement a few of these into your Thanksgiving dinner. And have a wonderful night.
Hello, my name is Jamie Garry. I'm a clinical research dietitian at Mass General, and I've worked with Dr. Wills on several studies surrounding diet and nutrition, namely in ALS and Parkinson's. I unfortunately don't have much experience with PSP directly, but I'm hoping that some of what we learned from the other neurological disorders can apply over as well. So I'm mostly just going to be talking today about healthy eating in general and discussing some of the different things that might benefit people living with PSP as well as their caregivers and family members. So next slide. Today I'm going to be reviewing some general healthy eating practices in general, and then discussing some common nutrition-related problems that sometimes affect people with PSP, including pace of eating, self-feeding, taste changes, dysphagia, weight loss, tube feeds, and then leaving some room for questions and answers. Next slide. So I just wanted to talk a little bit about my general philosophy about healthy eating. And it's basically that food is important both for providing nourishment as well as providing pleasure. And this applies for everyone, but especially for people living with a life-limiting disease like PSP. And I think it's important just to manage expectations and try to keep pleasure in food and try to avoid some of the stress that can come along with it, especially dealing with all the other challenges that are going on. As I did mention, as Dr. Wills points out, there is little data specifically on PSP. So again, bear with me if I respond to that way a lot for my questions. And so as I go through the presentation, I'll tell you as much as I know about healthy eating and how it may help you or your family member, but we don't really have specific data on the nutrition in PSP. And as with anything, mental health and stress levels also play a huge role in health. So pick and choose what ideas resonate with you and work in your life without feeling like you need to do it all. So moving on to the next slide of general healthy eating. This slide shows the healthy eating plate. The main idea of the balanced eating plate is that we should be aiming for a balanced diet with a variety of food groups, aiming to get at least half of our food from plants, namely fruits and vegetables. And then trying to get the other half of our plate mostly from whole grains or starchy vegetables. And then filling the rest out with proteins, a lot from plant proteins like beans, nuts, and seeds, as well as some of the lower fat proteins like poultry and fish. And then trying to have mostly unsweetened beverages like water. You can also do seltzer, tea, coffee, and then adding in some heart-healthy fats. So on the next few slides, I'm going to be diving into a few more of the food groups in a bit more detail. And I encourage you, even if the exact amounts seem a little lofty, just know that most research shows that setting small, manageable goals and changes can have big benefits over time. I know Dr. Wills mentioned the Mediterranean diet a little bit already, but I'm just going to dive into it a bit deeper. So I laid out the specific recommendations for the Mediterranean diet, including consuming 2 to 3 servings of vegetables per day, 2 to 3 servings of fruit per day, at least 3 servings of fish per week, at least 3 servings of beans or other legumes per week, using an abundant amount of olive oil, choosing whole grains over refined grains, and then moderating the amount of poultry, fish, and low-fat dairy you consume, and then limiting sweets, processed, and red meats. And if someone is already consuming alcohol, you can choose to continue choosing moderate amounts of alcohol, namely from red wine. And as Dr. Wills mentioned, some of the studies looking at the Mediterranean diet noted that there is some correlation for people following Mediterranean diet having a lower risk of developing Parkinson's disease, but there's currently no correlation of people following Mediterranean diet limiting the progression of the disease. That said, there is ample evidence that the Mediterranean diet can decrease risk of cardiovascular disease, cancer, type 2 diabetes, and there's been an increased interest in the Mediterranean diet in the association between healthy aging and cognitive function. So that's why we're going to focus on that today. In general, Mediterranean diet has been shown to be a well-balanced diet. It's relatively easy to adhere to with limited disadvantages. So I would recommend at least implementing whatever piece of the Mediterranean diet would work for your life. Okay. Now we're on to the next slide. One area I always like to highlight that frequently gets overlooked is consuming enough water. You've probably heard it a million times, but it's very important to drink enough water. We are, as humans, about 60 to 80% water, and our brains specifically are about 80% water by volume. Every cell in our body requires water, so it's really the most essential nutrient for our bodies. The exact amount of water you'll need will depend on your age, sex, weight, height, all that fun stuff. But the general rule of thumb of that 8-ounce glasses of water, which is about 64 fluid ounces of water, or 2 liters, is a good estimate. It doesn't have to all be plain water. So again, seltzer can be a good option. Coffee and tea and other liquids can also work. And then choosing other higher calorie liquids like juice and milk, and getting fluids in our foods like fruits, vegetables, soups, jellos can all add to our hydration status. So we just want to be mindful of the things that are not directly water. So if you're having coffee or tea that has caffeine, be mindful that caffeine can act as a diuretic. And if you are choosing some of the other things like juice and even milk, there are some sugars in those. So we want to be getting a combination of things, but making sure we're staying hydrated. And again, as Dr. Wills mentioned earlier, thin liquids are one of the hardest things to swallow. So in PSP, usually dysphagia is one of the first things that can happen. So dehydration can be a common issue. So in terms of dysphagia, I highly recommend anyone living with PSP see a speech language pathologist or an SLP, and they can perform the swallow study and help you determine the safest thickness of fluids as well as the texture of foods to choose. They can also recommend positioning and tips on how to safely swallow, among other things. So be sure to consult an SLP. I've also known a lot of patients with neurological disorders in general can have dehydration because of intentionally avoiding consuming water. They might be having trouble getting to the bathroom, either through ambulating or whatever. And I also know some caregivers or family members also specifically limit water at certain times of the day if getting to the bathroom is difficult. And again, I completely understand that. And it's all about kind of finding that balance between what makes everyone's quality of life better. So if you do need to limit fluids before bedtime so you're not having accidents overnight or having to get up in the middle of the night to change someone or their sheets, again, totally makes sense in some cases. But if that's happening, making sure you're getting enough fluid other times during the day. Some ways to making sure you're having enough water is to, for example, always make sure you have a glass of water with meals. Or some people keep a big bottle with them and they'll label it with times on it. So it'll be by 8 a.m. I should have drank up to here, and by 10 a.m. I should have drank to here, and by noon I should have finished this bottle. In some cases, the physically drinking water and just managing the cups and bottles can be difficult. So again, working with SLPs or occupational therapists to find adaptive cups and bottles that allow the individual to drink without assistance can be a game changer. And especially if thin liquids become a challenge, you can focus on getting more water through foods, like doing a thick puree type of soup, like do butternut squash soup or black bean soup that's well pureed, and adding in some extra water or broth. Or you could do a smoothie that has lots of fruits and vegetables in it and add in some well blenderized ice cubes to add in some fluid and thickness. And that brings me to my next slide, which is to eat the rainbow, and that is fruits and vegetables. So again, it's recommended to eat about 2 to 3 cups of vegetables a day, or about 2 cups of fruit a day. Which again, I know for a lot of this, that seems excessive in comparison to what you're eating. So again, a lot of it's meeting you where you are. So if you're currently only eating half a cup of vegetables a day, see if you can go up to 1 cup a day. And then eventually maybe you can continue increasing from there. I know in the headlines, we always want to have a miracle food or a superfood, like eating a cup of blueberries a day is going to be the answer to all of your problems. But really what we found is that variety is key, and that diet diversity can be really beneficial. In general, we want to focus on the brighter fruits and vegetables and the more nutrients. In general, the brighter the fruit or vegetable is, the more nutrient it usually contains. So choosing, for example, a dark leafy green like spinach or kale versus iceberg lettuce, or choosing a bright bowl of berries. In general, colors can be a good indicator of certain phytonutrients and antioxidants that are in plants, which is again why eating lots of different colors can be beneficial. So for example, purplish colored foods like red onions, blueberries, and grapes are all good sources of anthocyanins, which have been shown beneficial for heart health and fighting off oxidative stress. Red and pink foods like tomatoes and watermelon, grapefruit are high in carotenoids like lycopene, which is another antioxidant, and help fight off cancer and improve vascular health. So fruits and vegetables are also a good source of soluble fiber, which can improve your microbiome and improve the digestive system and how it works. If you're having trouble getting in enough fruits and veggies, you can do the smoothie loaded up with the fruits and vegetables, doing a cereal or a softer cereal if you're having trouble chewing, like oatmeal, and adding in some fruit on top. Still able to chew okay, maybe doing a sandwich with layers of vegetables, so like your typical lettuce and tomato, maybe even some slices of sweet potato, roasted red peppers. Making a pureed vegetable soup is a great starter for a meal, or even can sit between snacks. And trying to choose seasonal fruits and vegetables can help give you a greater variety. Next slide, choosing whole grains or starchy vegetables instead of refined grains can also be beneficial for you. Whole grains have more fiber, more natural vitamins and minerals than refined grains. And in general, the recommendation is to make at least half of your grains whole. So starchy vegetables can also be a good alternative instead of grains as well. So that would be like potatoes or sweet potatoes, turnips, and butternut squash. And examples of whole grains would be like whole wheat. So thinking about whole wheat bread or pasta, brown rice or wild rice, oatmeal, corn, millet, bulgur, and quinoa. And next slide shows a visual. So on the left here, I have a picture of a whole grain. So on the outside of the grain is the bran, which if you think about like bran flakes, that's what they're talking about. So the bran is going to be where the fiber is, as well as the B vitamins and the minerals. It's what takes a while for our body to break down. So that's why it's going to slow down absorption to your stomach. It's going to help you feel fuller longer and help stabilize blood sugar. It's also going to add bulk to stool. So it helps prevent constipation, also helps to lower cholesterol. The inside of the grain is the endosperm, which is what I usually call like the white fluffy stuff. There's also some protein and vitamins in there too. And in the center is the germ, which if you think about like the wheat germ. And so this is like the grain's little vitamin pack. It also has some healthy fats, vitamin E, and phytonutrients. So again, if you think about people who eat wheat germ, it's just like the inside of the wheat kernel. On the right side of the screen is a refined grain. So that has the bran removed and the germ removed, and you're just left with like the white fluffy stuff. So that gets absorbed into your body a lot faster than a whole grain, and you don't get the benefits of the fiber, the healthy fats, and the vitamins and minerals that you would get from a whole grain. Some of the ways that you can incorporate more whole grains into your diet would be to choose whole wheat bread versus white bread, buying brown rice or wild rice instead of white rice, or trying a new grain like quinoa, millet instead of rice or pasta. And moving on to the next slide, another key aspect of the Mediterranean diet is choosing heart-healthy fats. The general rule of thumb is to choose more plant-based fats versus animal-based, aiming to choose fat from plant sources like olive oil, vegetable oil, nuts, and avocados, as well as fish, especially fatty fish, can be beneficial. Avoid eating saturated fats, which are mostly going to be from your animal sources like red meats, high-fat dairies, and butter. One way I like to think about it is healthy fats, which are the unsaturated fats, tend to be liquid at room temperature. So if you think about like vegetable oils, or like if you have natural peanut butter and the oil separates out to the top there. So the things that are liquid at room temperature are going to be sort of liquid in your body, help keep things moving smoothly, versus your saturated fats, which are the less healthy ones, mostly in your animal products. So those would be like, those are going to be solid at room temperature. So think about a stick of butter, or if you cook like beef or anything and you get that like congealed fat at the top. So those are the ones that are going to solid at room temperature, solid in your body, clog up your arteries, maybe your brain. That's not the exact science. There won't be like butter in your brain, but I like the visual reminder. And moving again on to the next slide. Along the same vein, choosing more of your plant-based proteins versus animal proteins. And then fish is always that one that kind of sneaks in there along with the plants. So fish and shellfish are both lower in saturated fat than meats and poultry, great sources of omega-3s, polyunsaturated fats, and then choosing other plant-based proteins like your beans and legumes, nuts and seeds, again, all good sources of fiber, vitamins, minerals, and again, those healthy fats. And then moving on to the next slide, another focus of the diet is to limit the red and the processed meats. Per the Mediterranean diet, they say no more than 2 times per month. Again, do what works best for you and your lifestyle. But these fats to avoid include, or meats and proteins to avoid or limit would be beef, sausage, bacon, lamb, processed meats like deli meats, hot dogs, smoked and cured meats. These foods are all going to have more of the unhealthy fats in them. And they also tend to have a lot of other additives like sodium, which isn't great for us, and sometimes other like nitrates for curing. And on to the next slide. The last part of the Mediterranean diet I wanted to focus on is just to limit discretionary calories. So discretionary calories are going to be things with added sugars, solid fats, and then excessive alcohol, or like highly sugared alcohol, like if you're having a margarita. That being said, again, you can certainly eat some of these foods, especially if they're bringing you joy. Just be mindful not to only eat these foods. If nothing else, you probably won't feel super good afterwards. So anyone who's ever experienced having like a Halloween candy binge or going a little overboard at the Chinese buffet knows that you inevitably won't feel too great. So we want to focus on getting most of our nutrition from eating those other whole foods like fruits, vegetables, whole grains, etc. And then again, kind of rounding out your diet with these extra treats. And next, I'm going to move on to some common related nutrition problems that can affect people with PSP, and also some that we can all relate to as well. So in the next slide, I talk about difficulty self-feeding. So one thing again is work closely with your speech language pathologist and occupational therapist, maybe also with a physical therapist. The SLP can teach you how to set yourself up or your loved one up to help eat safely. Occupational therapists are the gurus of the assistive devices and creative hacks to make feeding easier. One of the main issues that people living with PSP have is the supranuclear gaze palsy, where they have trouble looking up and down. So one of the important things to do is position foods in a way so they can see their whole plate. So if you have it flat on the table, they might only be able to see the food that's closest to them. So if you can level it up a little bit, either by getting a special plate like the one kind of shown here where one side's a little bit higher than the other, or again, just propping something up like on a book, for example, or whatever works best for you, might be a good option to make it a little bit easier to visualize the entire plate at once. Some individuals also develop difficulty manipulating cutlery, like forks and spoons, either because of tremors or some wind up with pain or stiffness in their hands. There are again some assistive devices that might have either a wider handle or a strap that will attach the utensil to your hand. So those modified utensils can be beneficial as well. You could also just choose items that are a little bit easier to eat or that don't require utensils, like sandwiches. So for example, if you're trying to think of something healthier, you could do like a tuna fish sandwich with very finely chopped up diced celery and carrots, and do it on a soft whole grain bread and then cut that into quarters so it's easier for the person just to pick up versus having to deal with the various utensils. Moving on to the next slide. Taste changes are another big problem or another common issue that come up with people living with PSP. Many people develop a preference for eating really sweet foods. So some things you could do with that would be to choose foods that are naturally sweet, like fruit, or adding healthier options to sweet foods, like choosing like a whole grain cereal or again oatmeal, and then topping, or you could either take your oatmeal and then top that with the sweet fruit, or even if you're doing like ice cream, for example, as your sweet treat, you could top that with like a whole grain cereal and throw some like bran flakes on top of that so you get a little bit of something healthy with it. Also, some people do well with trying other strong flavors, so choosing things that are very spicy or sour might be another good option. And then again, just coming back to managing expectations. So I know I spent the first half of the presentation talking about healthy eating, but I acknowledge that you don't have to eat healthy all the time. So if some sweet foods bring you pleasure, I'm all about throwing in a sweet or two a day. On the next slide, again, dysphagia I know is one of the biggest problems. I know Dr. Wills covered this and Mansi displayed some of our dysphagia-friendly recipes. So I'm going to breeze through these couple slides. But again, I would encourage you to work really closely with an SLP to find the right texture and potentially thickening liquids in order to eat safely. If it does become too unsafe or too difficult to eat, you might consider doing a feeding tube to meet some of your nutritional needs. And then on the next couple slides, I just have some foods that will be easier for, or recommended for early modification that are softer and easier to swallow. Moving on to the next slide. So again, this just goes through some items for early food modifications for trouble swallowing. Again, they wouldn't work for everyone. So again, like milk and milkshakes, again, you still might have to thicken the milk if you're having trouble with thin liquids. Yogurts, for fruits, choosing either fruit juice or nectars, canned fruits, or fresh ripe foods, and avoiding the skin. And cooking your vegetables well, choosing soft or moist meat and fish can be a good option there too. Choosing eggs that are soft cooked or scrambled, and again, sandwiches that are soft bread and softer broken up pieces. On the next slide, continue going through the different food groups. So again, starches that are cereals, well softened in milk, well cooked or softly cooked like French toast or pancakes. Again, I know some of this kind of contradicts each other because I mentioned you having like whole grains and it says white rice, but again, finding what works best for you. And then for the fats and oils, some of the things on there, like again, avocados would be a great option for meeting the Mediterranean diet, as well as adding in some healthy fats there. And the oils, like olive oil, vegetable oil, can also be great for adding in some calories, some heart healthy fats, as well as can help to soften food. So if you were like mashing up some vegetables, for example, you could add in some oil, which would help to soften the food, as well as add in the heart healthy fats, add in some calories. So moving on to the next slide, I discussed some problems with weight loss. So a lot of people wind up having weight loss, and this can be multifactorial, partially usually caused by dysphagia, also depression, and trouble self-feeding can all lead to some weight loss. So some ways to combat weight loss would be to try eating more calorically dense foods, specifically high fat or high protein foods. Again, like those avocados, olive oil, fatty fish, nuts and seeds. The nuts and seeds, for example, can be ground or pureed to make them a little bit easier to eat or sprinkled into things. Sometimes eating smaller, more frequent meals can be beneficial. That way, especially if you're getting fatigued while eating, it can be good to break up the meals throughout the day, keep it from being too exhausting for eating. Sometimes liquid calories can be beneficial. So again, doing like the pureed soups or smoothies, or doing a meal replacement shake. Pardon me. Again, just be mindful to thicken any fluids as needed. Also, again, considering a tube feed for supplemental calories if that lines up with your treatment goals. Moving on to the next slide. Goes into considering a tube feed in general. So tube feeds are going to be a very personal decision to make. So I would encourage you to talk to your care team and see if it lines up with the treatment goals. A tube feed can be a great option if eating starts to become too unsafe, if you're having trouble aspirating or choking, if eating gets too difficult and too tiring, becomes too time consuming. So if the person's spending so much, if your loved one or you're spending so much time trying to eat the food and just you're spending more time trying to eat and getting too tired from it, it can be beneficial to try not to stress as much, maybe have a tube feed as supplemental. And if eating becomes no longer enjoyable, tube feeds can be used either 100% of the time if you want to, or it can be used in conjunction with eating by mouth. So some people get the tube feed placed and they will just use it for example, getting enough hydration in. So they might just take water by the tube feed, or they might take their medications that way. Or again, you might choose to eat the foods that you really enjoy and then get the rest of your calories through the tube feed. So it's not an all or nothing type of situation. But again, it is a big decision, so something that can be considered. Next slide, I saved this one for the end for pacing of eating. I know we're moving into our lunch break soon, so pacing of eating I know is something that a lot of us struggle with, whether or not we have a neurological disorder. So some things that work well for everyone can be timing meals. So what they found works sometimes is for people with PSP is to actually set a timer and have them visually see it and say, like, this meal should take you at least 15 minutes to eat, because kind of the mouth stuffing is a common problem. So if you set the timer, for example, for 15 minutes and then try to take that full 15 minutes or 20 minutes, however long it is, that can be beneficial as far as preventing you from mouth stuffing. And again, a lot of us do this even if we don't have PSP. If you're the caregiver of someone with PSP, sometimes verbal cueing can be beneficial. So specifically telling them, take a bite, chew, swallow. It sounds kind of silly, but again, frequently the cognition is still there. They just have trouble implementing it. So giving the verbal cueing, telling them to slow down can be beneficial. In some cases, I've been told they also can have trouble physically opening their mouth to eat, in which case sometimes sort of tricking them into doing it by tricking like your mind. So like one of the SLPs I work with mentioned to, bring the spoon to their mouth and then say like, laugh, and that will get them to open their mouth. So again, it really depends on what stage of PSP they're in and what works best. Also avoiding distractions. So try to, if you're eating, just eat. Don't try to be watching TV at the same time. And again, chewing and swallowing one bite before offering the next. And again, trying to have the smaller, more frequent meals can be beneficial as well. So again, if instead of offering like a giant plate of food, try doing, again, the smaller meals throughout the day. And that might also be less tiring as well. Again, since I know we are moving into lunch, you can perhaps practice some mindful eating. And mindful eating is essentially just being aware of what you're eating. So one practice might be, again, taking whatever food item you're going to eat. So for example, for some reason, mindful eating, we always like to use raisins for an example. You take your raisin, you look at it, acknowledge all the little grooves, thinking back to this raisin was once a grape that grew on a vine. And there was a person who came and picked that raisin or picked that grape and then dried it to become a raisin and then packaged it and drove it to the store. And now I am buying this raisin. Now I will eat it. And when you put it in your mouth, seeing if you can actually enjoy the flavors and the textures and being mindful of your chewing and acknowledging as you chew and what flavors arise, and then feeling the sensation of swallowing the raisin as it travels down your throat, whatever food you happen to be eating. Again, just kind of being mindful of what you're actually eating, and then over time noticing how it made you feel and trying to eat when you're hungry, trying not to eat when you're not hungry, if you're just eating emotionally. So again, that's something that we can all practice both as caregivers or individuals living with PSP. So moving on to my last slide, I think, so my general takeaways would be to continue working with your healthcare team. So again, your neurologist, your doctor, SLPs, physical therapists, occupational therapists, social work, they can all be amazing resources. Try to focus on enjoying your food, and again, focusing on food for nourishment of the body and for pleasure. And then I just have a couple quotes here that I like, including eat food, not too much, mostly plants, by Michael Pollan. And that sort of captures a lot of the Mediterranean diet. And then because Oprah knows all, she says, you can have everything, just not all at once. So again, just thinking about those treats and everything else. Again, have a nice variety of food, but spaced out across the day. And so that concludes my presentation. So thank you. I think the next slide just says thank you. And I will take any questions.
Thank you so much for that. We do have a couple of questions that have come up. Some are pre-submitted, some are coming live. One question is, what are some easy recipe hacks to adjust meals for myself so I can also enjoy a meal that isn't solely focused on a patient?
So I think in general, trying to plan all of the meals as far as maybe thinking of something that you would enjoy as well. So for example, if you were going to make a meal looking similar to that Mediterranean diet or the healthy eating plate, and then seeing how you could adapt it for the patient could be beneficial. Or again, choosing things that might be able to be modified easily. So I keep coming back to soup, for example. But if you had, for example, like a black bean soup, you could have one, you could make it first for yourself and it could have some decent chunks of black beans in it. And then you could even serve it for yourself, maybe with some whole grain tortilla chips or some chunks of avocado or things like that on top of it. And And then for the person with PSP that you need to maybe make it a little more pureed, you could use an immersion blender or a food processor and blend it down even more so that it doesn't have any of those chunks in it. And again, obviously skip like the chunky tortilla chips. Or again, if it was making, we'll say if you're making yourself a burrito, I don't know, I'm on a Mexican kick here. So you would have your, whole grain tortilla and then maybe fill it again with like your beans and all your vegetables. Have yourself a regular burrito, but then for your family member, whoever you're taking care of, you could take sort of the innards of that and perhaps puree different things for them. So again, maybe blend up the black beans, blend up some of the vegetables. You can make that all together, and something of that nature. A lot of the foods, I think, do work for both the caregiver as well as the loved one. So for example, fish is a good option. Again, fish is well recommended for most people, assuming you don't have a fish allergy. So choosing, again, fish that's pretty soft already, so you can enjoy that. And then also make it for your loved one. And if you need to make it a little bit softer for them, you can, again, mash it up a little bit more. Or if you needed to add something in to make it a little bit softer, like maybe a little bit extra drizzle of olive oil or some lemon, and that can be beneficial for them as well. So hopefully that
Perfect. Thank you. Someone would like to know, is raw coconut oil recommended?
So coconut oil in general has become popular, at least over the last decade or so. The jury is still somewhat out. So coconut oil it's a little funky because it's a plant fat, but it is mostly saturated fat. So again, if you think about the solid at room temperature, and they've done some research trying to see if coconut oil is still would be a healthier fat, even though it is a saturated fat. But the jury is still somewhat out on that. There hasn't really been any good evidence that coconut oil is really healthy for you. So I still sort of err on the side of limit coconut oil because it is more of the less healthy fat. As far as raw coconut oil versus processed oil, I honestly haven't seen any research diving into that more deeply. So I can't speak to that. I'm sorry.
All right, thank you. Someone would like to know, if a PSP patient eats later in the day, does that cause nighttime incontinence?
So incontinence is something that starts to occur or can frequently occur in PSP. In general, if you are eating later in the day, you might be more likely to have, as far as stool incontinence, it's possible, but in general, everyone's digestive system works at such a different pace. I would say you're more likely to, I suppose, have urinary incontinence if you're having a lot of liquid in the evening. But as far as bowel movements, especially as PSP progresses, there's a lot of dysmotility in the gastrointestinal tract, so foods do tend to absorb slower. So in general, I wouldn't say that necessarily eating later is going to increase incontinent bowel movements more. And again, in general, eating later in the day can be not great as well as far as acid reflux goes, since the dysmotility does tend to also occur in the esophagus. So if you eat and then if you lay down, there's more likeliness going to be that some of the food might come back up the esophagus. So in general, you might want to not eat a large meal too late in the day, but I'm not sure if it would necessarily bring on additional nighttime incontinence.
Terrific, thank you. Will 5,000 IU of vitamin D3 soft gel help with mobility and digestion?
There has been some research as far as vitamin D in Parkinson's. I'm not sure if it's been specifically studied in PSP. I couldn't find anything on that. In general, what they seem to have found is that people with low serum levels of vitamin D, meaning there's not enough vitamin D in your body, they're more likely to have some of the dysmotility issues. The general recommended dosage of vitamin D tends to be about 1,000 IUs a day. Again, you can consult with your doctor if you are deficient and you're pretty significantly deficient, sometimes they'll put you on a higher dose. I've seen up to 50,000 IUs, sometimes weekly. So you can talk to your doctor as far as the recommended doses for you specifically, but vitamin D is one of those things that's very hard to get through your diet alone, since most foods don't have it. And especially now as we're entering the winter, more likely to be harder to get vitamin D for ourselves in general. So it certainly wouldn't hurt to take a vitamin D supplement. Again, the exact dosage I would contact your doctor with, but in general, I usually recommend about 1,000 IUs a day.
Thank you. Someone would like to know, how many hours before bed should you stop drinking liquids to reduce the chance of having to get up in the middle of the night?
Well, again, it's not something I don't necessarily recommend limiting liquids. I understand that people do that. Usually about an hour or two before bed, it might be good to start to decrease liquids. And again, everyone's body is a little bit different as far as how quickly they process it. And again, if you are limiting liquids before bed, I would definitely start to drink more often in the morning to make sure you are getting adequate hydration. But usually about an hour or two before bed should help to prevent having any nighttime accidents or having to get up as much.
Thank you. Do PSP patients need to have protein-based diets, protein-based recipes? If so, are there any recipe recommendations?
Everyone needs protein. I think in general, at least in America, our culture tends to be a little bit more protein focused than we necessarily need to be. It is important to get some protein in there. So proteins are going to be anything. So again, plant-based proteins would be your beans, nuts, seeds, tofu, and then animal-based proteins would include things like chicken, poultry, turkey, red meat, fish, shellfish, eggs, dairy. So they are all pretty common things that they seem to be like what most Americans eat as the base of their meals. So I guess any of those things, if you wanted to add them in, would be good options. I think as far as, again, like softer foods that would be beneficial for dysphagia would normally be more of like the fish, which is good for the Mediterranean diet, as well as a nice soft food. And eggs can also be nice and soft as well. So it's not really a specific recipe, but if you wanted to, I could certainly provide some of those after the fact as well.
Excellent, excellent. And we have time for one last question. Are there some foods that are considered mood boosters? And if so, what might they be?
So as far as, again, this is kind of one of those like sexy topics that people want to hear, like the foods that like will solve all their problems. But in general, and again, I keep saying this, but fruits and vegetables tend to have a lot of the antioxidants in them and do seem to be beneficial as far as improving mood. Overall, they have done some studies that just as far as following the Mediterranean diet, which again, plant-based, lots of fruits and vegetables, do tend to improve cognition as well as mood. So trying to follow some of those recommendations. So lots of variety, lots of plants, and the heart-healthy fats have been shown to improve mood.
Thank you so much. This information has been incredibly valuable. We really appreciate it. For those of us on the East Coast, we're going to go head into a lunch break. For those of you on the West Coast, you're going to head into a coffee break, I suspect. And once again, thank you so much, Jamie. We really appreciate you being here.
Thank you so much for having me. It was a pleasure.